Okay, so let's talk about herniation syndromes. This is part 4 of a series called Head Trauma, where we will discuss things pertaining to neuroradiology. Herniation syndromes are the most common sequelae of an expanding intracranial mass, including a bleed. Before learning further, we must know that our intracranial cavity has been divided into a supratentorial and infratentorial compartment by the second largest dural fold, the tentorium cerebelli. The infratentorial compartment is composed of the cerebellum, the brainstem, the fourth ventricle. The supratentorial compartment is in turn divided by the largest dural fold, the falx cerebri, into a right and left hemicrania. Number 1 is the subfalcine herniation, which is the most common type of herniation. Here there is shifting of one hemicrania across the midline towards the other side under the inferior free edge of the falx. The structures involved: the cingulate gyrus, the anterior cerebral artery, and the internal cerebral veins, all of which are displaced to the opposite side across the midline. In the CT picture, we see a large crescentric hyperdense collection in the right lateral convexity and acute subdural hemorrhage, a right to left midline shift along with subfalcine herniation. The ipsilateral lateral ventricle is effaced with contralateral dilatation of the lateral ventricle. Next is the descending transtentorial herniation, which is the second most common herniation syndrome. Here, the supratentorial brain tissue descends downwards through the incisura, which is a gap anterior to the free edge of the tentorium cerebelli into the infratentorial compartment. These are of two types: lateral descending transtentorial herniation and central type. Lateral is where the medial temporal lobe descends downwards. Lateral is of the anterior type, where the uncus descends into the ipsilateral crural cistern. In the posterior type, the parahippocampal gyrus herniates into the posterolateral aspect of the incisura. In the central type, the diencephalon, midbrain, and pons descends downwards. In the CT picture given here, we can see that the right-sided uncus is descending downwards across the tentorium cerebelli, and there is compression of the ipsilateral crural cistern. The ipsilateral ambient cistern is widened, and the contralateral temporal horn of the lateral ventricle is also dilated. This is an anterior type of lateral DTH. On the CT image on the left, we see that the bilateral temporal lobes have descended through the tentorium, and there is effacement of both the suprasellar as well as the basal cisterns. The midbrain is pushed inferiorly, and there is compression of the perimesencephalic cisterns, that is the cisterns surrounding the midbrain, which are mainly the interpeduncular cistern, the crural cisterns, the ambient cisterns. Effacement of quadrigeminal cistern is more important for ascending type of transtentorial herniation. On the right hand side is an image of a normal brain where the cisterns are still intact. If you want, I can make a separate video on the subarachnoid cisterns. The next is a tonsillar herniation, where there is inferior displacement of the cerebral tonsils, which gets impacted at the foramen magnum. It is the most common type of posterior fossa herniation. Congenitally, they may be seen as a part of Chiari malformation. Acquired forms are seen in any form of posterior fossa mass. The image on the left hand side is a sagittal T1 image, where the tonsil is seen to be inferiorly displaced by more than 5 mm below the foramen magnum. The medulla is displaced anteriorly. In the right hand side image, it is a axial T2, where we see the in the foramen magnum, the CSF spaces have been effaced. The next one is the ascending transtentorial herniation, which is a rare form of posterior fossa herniation, where there is an expanding posterior fossa mass, which is mostly a neoplasm, then a trauma. Here the cerebellar vermis and the hemispheres are pushed upwards through the incisura into the supratentorial compartment. Okay, so that's all for today's session. Hope to meet you soon in my next video.